Hello everyone, and welcome to the 9th Talking Tuesday video series, where we review frequently asked questions and topics specific to health links and coordinated care plans. In this session, we will be reviewing frequently asked questions related to the coordinated care plan in Health Partner Gateway. There are several resources that I'll be referring to throughout the session, and all the resources can be accessed through the Health Links webpage on the H&HB LHIN website. And some of you may already have access to your own organizational resources as well. During the session, the assumption is made that all attendees have attended the initial HPG training and are currently utilizing HPG to access their clients' coordinated care plans. We will be covering a total of 9 frequently asked questions in this session. The first frequently asked question is, how is access to the CCP granted? And what happens when I'm away? So I want to start by differentiating between individual user accounts in HPG and access to care plans within HPG. So when an organization submits a list of users to the H&HB LHIN, each user is given their own account with a unique username and password. This account is associated with the organization that you work for. If you do work for more than one organization for whom you are using care plans in HPG with, you will receive a separate account for each organization. Access to a client's coordinated care plan is granted at an organizational level. So this really means that a client consents to your organization having access to their coordinated care plan. Every member of your organization who has a user account to access the care plan in HPG will be able to search for, find, as well as access the client's coordinated care plan. So again, this means that when you are away, the colleague providing coverage for you will be able to access your client's coordinated care plan and provide the reasonable support that is required. It is important to remember to adhere to privacy legislation, organizational policies, and HPG terms of use when accessing a client's record. The second frequently asked question is, how do I open a new CCP in Health Partner Gateway? The first step to opening a CCP in HPG is to ensure that the client has an active record in CRIS. So CRIS is the LHIN's electronic medical record and speaks in real time to Health Partner Gateway. The first step to opening a CCP in Health Partner Gateway is to ensure that the client has an active record in CRIS. To request a client record to be open, please submit a completed initiation update form as well as a signed consent form to the H&HB LHIN using the fax number provided on the initiation update form. Remember to list the names of the organizations for the care team on the consent form using the correct names. This will be covered in a little bit more detail in another question in the session further on. So once received, a staff member at the H&HB LHIN will open a client record and give access to the client's care plan in HPG based on the organizations listed on the consent form. The integrated care lead that is identified on the initiation update form will receive a telephone call or a voice message to notify them that the client's record is now available to them. You can then log on to HPG and search for your client. Once you have found and selected your client, you will want to click the Add Care Plan button to initiate the coordinated care plan. And just remember that there is no need to start a new coordinated care plan if there is already one in progress. And you can also refer to the user guide for the HPG or CCP and Health Partner Gateway resources for more detailed instructions. So the next frequently asked question, so once you have submitted an initiation update form and consent form, but you still can't find the client, so how do I find the client CCP? There are several reasons that this may occur. When searching for a client in HPG, on the client search page, you will want to ensure that the Hamilton Niagara Haldeman Brant LHIN is selected in the organizational drop-down menu. Next, you want to select a search option. So the most common search method is by surname. However, the health card number is also the most reliable way to search for a client wherever possible. The search field is not case sensitive. However, it does require the exact spelling. If you are unsuccessful in the first search, try searching by the other options that are provided. And just as a reminder, you want to select the actual search button as you see on the screen, as hitting enter on the keyboard will not generate a client search. Verifying the spelling of the client's name is very important. When the client record is opened, the name is auto-populated based on the name associated with the client's Ontario health card number. If the client does not have a health card, the name is entered manually based on the name that is provided on the form. Your search will return the names of those clients who have provided consent for your organization to access their coordinated care plan in Health Partner Gateway. If you are unable to find a client, please review the consent form to ensure that your organization is included on the form, it is named correctly, and that it has been submitted to the H&HB LIN. So continuing with this question, you will only be able to access the CCP and HPG if your organization has requested that you, as an individual user, has access to the CCP and HPG. HPG has multiple functions and uses, and not all the users have access to the coordinated care plan. If you work for more than one organization that uses CCP and HPG, ensure that you are logging in using the correct username as well as the correct password. If you are still unable to locate your client CCP after the above suggestions have been exhausted, you can email ask.healthlinks@lins.on.ca for non-technical IT support, or you can email hnhb.it@lins.on.ca for specific IT-related support. Next, we'll be reviewing how do I add to the CCP that has been started by another HPG user or care coordinator. So adding information to an existing in-process care plan is actually very simple. If the client has a coordinated care plan in HPG that is already initiated, when you log on to HPG, you want to search for and select your client. The in-process CCP will automatically open. If the client has a completed coordinated care plan, or this is the client's first coordinated care plan, you will be brought to the care plan list page. In each of these situations, you will also select the Add Care Plan button, as we had seen previously. And if there is a previously completed CCP, you will have the option to copy the most recently completed CCP and then build off of that. So this is a recommended process. At this time, you can proceed to the section of the coordinated care plan that requires updating and select the Update section. Remember to save the changes when you are finished, and you're able to refer to the user guide for more information. If you do need access to a care plan that isn't a Health Partner Gateway, remember to submit the Initiation Update form as well as a signed copy of the consent form. Next, we'll be reviewing what sections of the Initiation Update form do I need to fill out. And when do I do this? The Initiation Update form is divided into several sections. So each section has a very different purpose. The form is primarily used to request that a client record be opened. However, it is also used to update demographics section, update primary care provider information, update performance measures such as the confidence score. You're able to add or revoke permissions to access the CCP and Health Partner Gateway, notify the LIN of a change in status, or update the integrated care lead information. Please review the CCP Initiation Update Form Guideline document for details. So included in that patient's job aid, you will be able to find a quick reference table to tell you when to submit the form to the LIN and what sections need to be completed. Please note that the demographics section should be completed every single time. For instance, if there is a new care team member that requires access to the coordinated care plan in Health Partner Gateway, you want to complete the demographics section as well as Section D that states add or revoking permissions along with an updated consent form. You only need a consent form when you are requesting access. If the form is missing required information, it will be returned to you by fax along with a cover letter that indicates what additional information is required from you. The form cannot be processed until it has been revised and resubmitted. The next question is, how do I know what organizations have access to HPG? And how should I list other care team members on the consent form? This is an excellent question and is one of the most common reasons that consent forms are returned to users for revisions. So each subregion within our LHIN has developed resources to provide you with information about who has access to the care plan in Health Partner Gateway. Remember that some organizations will participate in coordinated care management using a paper copy of the coordinated care plan as well. When listing organizations on the consent form, you want to refer to the resource that is titled Naming Care Team Member Organizations for Patient Consent Form. So there are really hundreds of organizations that use HPG for a variety of functions throughout the province of Ontario. It is important that you identify the organizations correctly on the consent form as was previously discussed. And this is really to ensure that access to a client's record is granted to the correct organization. Not doing so can result in potential privacy breach. If organizations are not listed correctly on the form, it, along with the initiation update form, will be faxed back to you for revision and resubmission prior to it being processed. The next question is, how will I know if one of my client's coordinated care plans have been updated? So when a client's coordinated care plan has been updated, an email notification will be automatically generated. So this email is referred to as the CRIS notification, which you can just see on the screen right now. These emails are sent out automatically to an email address or distribution list that is provided by your organization. A reminder that access is granted to a client's record at the organizational level. So this means that all members of your organization would receive the notification regardless of their direct involvement with the client. The CRIS notification has a hyperlink that will bring you to the HPG logon icon and directly into the client's coordinated care plan. It is important to note that not all organizations have chosen to use this feature in the exact same way. So some of you may receive all CRIS email notifications, including those clients for whom you are not part of the care team, whereas other organizations have designated individuals monitoring the notifications, and then they'll be forwarding them to individual users. And other organizations are choosing not to utilize this feature whatsoever. You can always check the activity in your client's CCP by opening the client's care plan and selecting the Audit Log tab. This audit log will show you all activity that has occurred within HPG for a given CCP, including who has viewed or updated the coordinated care plans, the sections updated, as well as the PDF copies that have been generated. The next question is, if I need support with HPG, who can I contact? So if you do require technical support, such as assistance with your user accounts, password, or user access, please send an email to hnhb.it@lins.on.ca. And as mentioned previously, if you have questions about HPG functionality and features or require support with troubleshooting, non-IT related issues, please review the documents and resources available on the HB LHIN website. However, if you still require support, please email ask.healthlinks@lins.on.ca. A reminder not to share the client information in an email. Please provide details about the problem or issue as well as your contact information. So just a few key takeaways from the session. So Health Partner Gateway is a secure web-based portal application that supports the exchange of information between a LHIN as well as an external partner. HPG can be accessed from any computer that has a stable internet connection with access to Internet Explorer 11 or higher, that has Chrome or Safari. Only organizations that are Health Information Custodians, or HICs for short, are able to gain access to Health Partner Gateway. HPG allows users to add, edit, and view the coordinated care plan and share the CCP electronically or generate a PDF copy of a client CCP. Access to a client's coordinated care plan in HPG is granted at an organizational level, though each user has their own account and associated username and password with it. The initiation and update form, as well as the client consent form, are required documents that are needed to be completed prior to being able to access, update, or add a client's CCP and Health Partner Gateway. And lastly, forms that are completed incorrectly will be returned for revision and resubmission before they can be processed. The last slide here just has numerous resources for your reference. And although the first two links here are hyperlinks, they will be included in the YouTube description below. So thank you very much for tuning into session 9, and stay tuned for session 10.